what can you do to integrate some of the things that I'm talking about so that it can have an impact to improve health outcomes, particularly in Tennessee, or wherever you guys end up. If there's some students, I don't know if there's students here, um, where that's going to be. And so to me, looking at this, I'm like, wow, this is where we really have got to look at how to intervene. And Tennessee is faced with a maternal health crisis. Vulnerable populations, those with a history of trauma, they are faced with these compounded challenges in accessing, benefiting from maternal health care. And I think these challenges disproportionately affect their health outcomes. They're coming to you with some of these issues. I think as providers, we're in a very unique position to mitigate some of the effects of trauma, not to re-traumatize individuals, and not to make things worse, in some way to improve these maternal health outcomes. Vulnerable populations, low income individuals, racial and ethnic minorities, rural people in rural areas. Unbelievable how people, it's like the rest of the world has passed everybody up. And they're in these rural areas. It's unbelievable the abject poverty that people live in. I used to live in Florida when I went to get my doctorate, and we went into rural areas collecting data, and it was just like mind blowing how the conditions of people living, even I'm in the state of Illinois, and even in Illinois, down south, Illinois is another issue in rural areas. So it's all across. Um, let's see, trauma can manifest heightened stress, mistrust of the healthcare systems, difficulty engaging in care. All of these can negatively impact maternal health outcomes. Uh, Yeah, so I'm not the only one that's realized this. The American College of Obstetricians and Gynecologists, this is their statement. They're saying that, hey, should become familiar with the trauma-informed model of care and strive to universally implement a trauma-informed approach across all levels of practice with close attention to avoiding stigmatizing and prioritizing resilience. It emphasizes like we play such a critical role in patient outcomes, patient experiences. We need to be familiar with what it looks like. What does trauma look like? What is trauma-informed care? What kind of model is that we should be incorporating in our practices, making sure that we're incorporating. This involves recognizing this widespread impact of trauma, and how we can tailor to address its effects. They are talking about universal implementation across all levels of practice. Hello. So this means you're not burying our head in the sand and just focusing on individual work. I mean, it's stepping up, taking a step back because you guys are in a unique position and doing some advocacy work. I'm a social worker, so as a social worker, we believe in deconstructing